Hello everyone, welcome back to my YouTube channel. So today I'm going to explain you how to do the wound assessment and your wound swab. So let's do the wound assessment first, and this is our wound, for example. Well, for example, let's just you know just understand that this is on the patient's body, and this is my kit where this is the wound pack that I have already opened, and this is all the cottons and all the I've already put saline in here, right? So I'm gonna explain you how to do this wound assessment before getting into the room. So first of all, you have to get into the room, verify documents, get the pathology report as well, identification, ask the name, date of birth, MRI number, right? And ask the pain, like do the PQRST assessment that we normally do the privacy, make sure to draw the cottons, give the dignity to the patient, explain procedure, what exactly you are going to do, right? And just ask patient if she or he want to go to the washroom or not. And once you have everything done, you always need to make sure that you are using ANTT, which is aseptic non-toss technique. That means that if you are using this tongue, you should be always here, and if for this wound, you should go like this, and these tongues never, this forceps should never go there. And basically this is a forceps. I'm always misspelling this as a tongue. um, Now, so once that is done, how to do the wound assessment, so I'll tell you how to do it. All right, so this is our wound, and based on what algorithm we are going to do it, based on this one. I don't know if you're able to see this or not, but pull up the camera. Okay, so this is the whole algorithm that we have, which is color of the wound bed, right? What is the color of the wound bed? You can assess here. So this is our wound bed and this is our surrounding skin, right? So we are only assessing the wound bed for this one, so we have to go into 100%, right? So what are the options we have? We have granulating, we have epithelializing, slough, necrotic. Granulating means bright red and red blood vessels having, right? And epithelializing means it's a new skin forming over the wound. That means we can only see it's granulating, right? So in my analysis, I can see 90% is epithelializing and 10% maybe no, sorry, 90% is granulating and 10% is epithelializing, because there is so little pink in there. So once our C is done, we'll go with O. That means color order of the wound. In my wound there is no order, so I'll just put nil. And the other one we have is drainage. That means exudate. That means any kind of leaking out of any wound, right? So what are the options? So you have to understand that as well. I have already made a video on this whole thing. So exudate is what kind of exudate it is: serous, purulent, hemoserous, sanguineous, right? So you have to watch this video that I have already uploaded to understand what I'm going through. Now, serous is like clear, watery, like water, so as in my, there isn't any kind of it's kind of really shiny, but there isn't any serous. Sanguineous is pink or light, like blood and fluid mixed. Sanguineous is mostly blood, which is bright red. Purulent is thick, cloudy. Infection, which is kind of a dead WBC, white blood cell, which is bad for infection, of course, for wound as well. Now, once the drainage is done, we'll go to the extent. So we have this measuring guide which help us to measure the wound bed. So we are not touching the wound, but we are doing the analyzing from the top. So my wound is one, let's do it again. So my wound is 2.1 and 2.2 on length and breadth. So I'll just document that on my chart so that I can have an idea of how big the wound is. And once that is done, we'll go to the surrounding skin. So now is the part to do the surrounding skin. That means the periskin, which is the outside part. So in my case, it is erythema. Erythema is like the red when the skin gets red and kind of feel warm around the skin, like inflammation or infection cause it normally when it's kind of pinkish and red, where it kind of is when ant bite you and it kind of, the skin kind of covers up, something like that. And there are otherwise macerated, dermatized, and a lot of option as well. But for now, this is what we follow the algorithm codes, so you have to go through this as well. Now once that is done, now you have to also be always careful about maintaining the ANTT, which is aseptic non-touch technique, because you might contaminate the wound with one another, which is absolutely dangerous, right? So how do you clean it? Then take this thing, take out the water and use this tongue always here. One hand behind your back, clean it, put in the bin. This one same. Clean it, this one, take it and tap dry. So once tap dry, you put the dressing on, that's done. So this is how you do it. I'm just showing you the most important thing that you need to do, and just follow the codes. That is exactly really easy for you. And watch my another video on wound care planning, where I have explained everything, how to fill up the form as well in an easy manner. All right, thank you for sticking to the end, and see you in next video. Thank you so much.